For pathologies in the upper limb, I just wanted to briefly go over the terms so that we are pronouncing them correctly. This is probably an area that we feel more comfortable with because as radiographers, we x-ray more bones than anything. So we get into the upper limb, shoulder, and lower limb, I think you will see a lot of things that you are very familiar with. Bone metastases are not a pleasant thing to see on a radiograph, but quite common if a patient has cancer and it metastasizes, that it does settle in the bones. And you can see how destructive this is as you scan through some of these images. And here's just a couple example x-rays of what bone metastasis looks like. We can also x-ray the bones and see things that are going on around the bones, such as bursitis. This is more seen on an MRI than a plain x-ray since it is soft tissue related. So there's an MRI image of bursitis. Carpal tunnel syndrome would be seen better on a CT scan versus an x-ray, but you may x-ray someone post-op carpal tunnel surgery. And then you should be familiar with the fractures and the types and names of them. So it's this slide and the next two slides after this that you should know all the fractures. Once in a while, when there's severe trauma to a joint space, you could either have blood or joint fluid accumulating in the joint space, and that's called a joint effusion. So it's important to include soft tissue as well on radiographs. And really with digital, they can window and level to see those, so technique is not as important as it used to be. We x-ray many patients with osteoarthritis, so you will see these types of degenerative joint diseases on radiographs, possibly standing knee or hips, and those would lead to joint replacement surgeries. And there are several images of osteoarthritis in the hip and knee and in the spine as well. And here's some example x-rays. And some more osteoarthritis. This is of the spine. Osteomyelitis. It's fairly common in diabetic patients because they get open wounds that do not like to heal, and the infection goes into the bone. So it's not a pleasant bacterial induced, but definitely something that we see from time to time. Osteopetrosis. So this is a hereditary condition. It's an abnormally dense bone which looks like a marble appearance. The image here is a 2-year-old with this inherited condition. Osteoporosis. We see a fair amount of in elderly people, especially in elderly women. It can lead to many fractures of the hip and spinal column. And compression fractures of the T-spine are fairly common. Here's some examples of osteoporosis. Paget's disease, so this is another destructive disease, and it's very easy to fracture. Here's some example x-rays of Paget's disease, and you can really tell how destructive this disease is. Rheumatoid arthritis, probably not as common as osteoarthritis, but definitely more debilitating for a patient. And these are some examples of what rheumatoid arthritis looks like. And these images, this is a skier's thumb. It's a tear of the ulna. ligament of the thumb. You can have tumors within the bones as well, such as multiple myeloma, osteogenic sarcomas, Ewing's sarcoma, and chondrosarcoma. Chondrosarcoma, which involves the cartilage. They can be benign or malignant in nature, but we would also x-ray either one of those, whether they are benign or malignant. And here's some examples of benign bone or cartilage tumors. And this sums up the lecture for the upper limb. Please let me know if you have any questions.